This is our interview with Erik, who has a cochlear implant and is in the process of getting another. What are cochlear implants?
Almost like a hearing aid, except it doesn't go inside your ear. The concept of a hearing aid is to collect sound and amplify it, or make it louder. It gives a way for the sound to enter your ear canal and get to your inner ear. For some reason, back in 2013, my hearing got worse. There is more damage to my inner ear. A cochlear implant is a surgical bypass. During the first surgery, the doctor surgically opens the skull and makes sure that everything is in good condition. Then a few months later, there is a second surgery that they insert the appliance and cochlear implant. Once that surgery is done and the area around the cochlear implant is successfully healed, 2 months tops, then the doctor gives me this, and that's called a nucleus.
Do you have currently 1 or 2 cochlear implants?
I have just one now on my right side, but I got the first surgery on my left side for the other ear back in February. I have the second surgery coming up to insert and apply the second cochlear implant.
How did you become hard of hearing, or why did you need to get a cochlear implant?
When I was 7, I had cancer. It's a very long name. It's called embryonal-rhabdomyosarcoma, ERMS. There was a big tumor that was between my nose and sinus. It was surgically removed. They removed the whole tumor in the surgery, but it was such a big tumor that some of the cancer cells remained in my body, in my face. I went through several years of chemotherapy and radiation treatment. It wasn't until 10 years later that I became officially cancer-free.
What led you to get the cochlear implants?
Because of my severe hearing condition, I can hear with 1 hearing device, but I'll be more successful with 2. With 1, I can hear, but I can't tell where the sound is coming from. Right now, if my mom is in the parking lot and she calls my name, I can't tell where her voice is coming from.
What was the hardest thing to do before getting the first implant?
Adjusting to the fact that I wasn't able to hear anymore. I just woke up one morning and I was 99% deaf. I couldn't hear anything. In the past, my hearing conditions were pretty severe, but when I took off my hearing aid, I could still hear. My mom especially, if she got close to my right ear, I could still hear when she spoke, but then I couldn't do that anymore. I think the cochlear implant is more advanced than your hearing aid. When I was a kid, I had a regular hearing aid, like the kind that goes over your ear. I had that from when I was 8, but that doesn't work for me anymore.
Is there anything you wish was better about the technology of the cochlear implant?
No. Everything I wanted to improve has improved. I think the cochlear implant works better than the hearing aid did. Plus, there's more cool stuff that comes with it. You get more sound accessories like different microphones that people can speak into and make communication better. And again, the sound quality is great. My hearing ability is better than it has ever been in the past.
Tell me, what was the recovery process like for you?
The first surgery, there's really not much to it. It was kind of like an outpatient surgery. I only had to stay in the hospital for 1 night just to monitor my condition. The recovery was only a month. For the second surgery, recovery is at least 2 months. That's when the implant is actually applied. It heals more slowly, and there's a lot more that goes on with it.
Can you tell me about your experience with your physician?
The doctor that has done all my surgery, he's from the University of Miami. He's been my doctor since I was diagnosed with cancer. I've known him pretty much my whole life, about 20 years. How have you gotten funding for the cochlear implants?
It's all been paid for through insurance, my mom's private insurance. Health insurance, just between me and you, sometimes they're hard to deal with, but my mom, because she knows me so much, she fights them to the finish. She continues to do what she needs to do to persuade them to keep paying for my surgeries.
What about replacements, batteries, and maintenance?
It always works. There's no maintenance. The batteries, they're rechargeable. If they are out, maybe somewhere over a year, you might have to replace them. I think it's a minor plus, the cochlear implant versus a regular hearing aid. With this right here is the battery.
Tell us about speech therapy.
Speech therapy is a different process for me. You don't really need speech therapy when you get the implants. Maybe for the first month, you might hear things differently, or someone's voice might sound differently. The very first sound I heard when I put this on was like talking in a big room. And the first time I heard myself speak, it was very different. You hear weird frequencies, very weird tones and sound. Everything sounded different. My own voice was very high-pitched, kind of like R2-D2.
Have you gone to any other therapies?
Not for my implants. The problem I had, everyone sounding high-pitched, it went away after a month. After that, everyone sounded more normal, including myself. I actually did get speech therapy last year, but not because of my cochlear implant. It was because of my cancer. I've had a speech problem ever since I was a kid. After quite a few years of getting chemotherapy and radiation, my whole head changed. Nothing was growing. My mouth became deformed, my upper teeth didn't grow in, and I had to get dentures. I didn't receive speech therapy growing up, though.
Do you have any advice for us as future occupational therapists?
The best advice I can give you is to be patient. First and foremost, it takes patience when people are getting used to the device and getting used to hearing again. I still have trouble hearing. Even though I'm using the best technology, I don't always hear every word the first time around. When you have a patient that has even a high-tech device, they still might ask you to repeat things. So yeah, it takes patience. Know too that a cochlear implant does have different settings. The environment you are in, depending on if it's loud or quiet or outside, it might take time to adjust the device for them to hear you.
Thank you so much for your time and talking with us, Erik. We really appreciate it.